Hello, everyone. It's Dr. Susanna here, back for another episode of the Alter Your Health podcast. And this week, we are really launching into our plant based life cycle nutrition series, starting off with the topic of preconception. We're going to be talking about how to prepare for a healthy plant based pregnancy. We're going to be covering the specific questions of how does one eat to support healthy preconception? What does the science say is the best way to eat? We're going to be addressing the question, what specific nutrients are key? Are there any special considerations for plant-based individuals who are looking to get pregnant? Any specific supplements that we might need to take? And what other lifestyle aspects are also important to consider when we are in this preconception phase? And now, before we launch into today's episode, I just want to acknowledge that the topic of preconception overlaps, of course, with this big, vast topic of fertility, infertility. A lot of the science that I'm going to be citing today is actually research done with, in vitro fertilization and other kind of assisted reproductive fertility methods. So there is some overlap here in this, realm of fertility and fertility, but please know that I'm not at all going to be talking about everything that plays into fertility and infertility. Really, what we're going to be talking about here is simply how we can support the body for a healthy preconception phase to prepare for healthy pregnancy. So, we've got a lot of information to cover. First, I think we should just kind of take a step back and ask the question, why is it important to plan for pregnancy in the first place? And so for the females, it's so important to recognize that so much, well, for both the males and the females, but first we're going to talk about the females. So much happens before the event of conception in order for conception to take place. We can go back all the way 26 weeks before conception is really when primordial follicles are leaving the resting state. So that means, we're born with all of our eggs in our ovaries, right? But they're not all ready to be fertilized. They still have to go through some phases of development in order to be ready for fertilization. So it's 26 weeks before conception that they kind of start to wake up out of that resting state. And then there's an active phase of follicular development that starts about 14 weeks before ovulation. So 26 weeks, 14 weeks, this is way, way, way in advance, before even the one menstrual cycle where that egg is going to be ovulated. So if we think about what environment we want this egg to be developing in, if it's going to be turning into our offspring, we want to create an optimal environment that has all of the nutrition, all of just the everything that we need to nurture that egg and grow it into a healthy baby, right? Also, it's so important to recognize that so much happens within the days right after conception. And usually the couple doesn't even know that they're pregnant this early on in pregnancy, right? Maybe there's been some planning, maybe there hasn't been some planning, and maybe conception happened planned or unplanned, but we don't really know until we get that positive pregnancy test, right? So placental development begins 7 days post-conception. That's 7 days. That's like nothing. So we need so much nutrition for this extra organ to develop for the female in the pregnancy stage. So another reason to just make sure that we are our healthiest selves before we get pregnant. Also, this is a really, really big one. For the baby, the neural tube forms in the 3rd and 4th weeks after conception. So once again, a lot of couples don't even really know that they're pregnant at this stage unless they're really on top of that, that pregnancy test. And this is when the baby, the fetus, is just so vulnerable, susceptible to just vulnerable to nutritional deficiencies. And specifically with the neural tube, we want to be really, really on top of some specific nutrients we're going to be talking about later in today's episode. But you all probably know that folate plays a really big role in preventing neural tube defects. Also, other organ development occurs between weeks 4 and 10 of pregnancy. This is just like a very, very important phase of organ development for the baby. So, yes, we want to make sure that, we're not just waiting around for that pregnancy test to be positive in order to really, take our nutrition seriously. We want to do so before conception happens. Now, if we talk about men or the males, it's like, why is, preconception planning important for males? We see that the spermatogenic cycle takes about 65 to 74 days to really produce the sperm. So there's also this period of time. It's not like the sperm is just pops out ready to go at conception. There's this whole period of time, 65 to 74 days also, where that development is happening. And you want to create that optimal environment with the nutrition, with minimizing toxicity, minimizing other kind of compounds that could kind of interfere with healthy development of the sperm. And the final sperm maturation occurs 10 to 7 days actually in the epididymis. There's also those 10 to 15 days prior to ejaculation or conception are especially important because finishing touches are being put on those sperm. So for the males, there's an argument that maybe the preconception planning doesn't need to be quite so long in advance of wanting to get pregnant as it does for the female, because the eggs do take longer to come out of that resting phase and develop to be ready to be ovulated. But my argument is that we want both male and female to be optimally healthy very far in advance before conception, because it's not only about making sure that we've got a healthy egg and a healthy sperm. It's about making sure we've got healthy parents, right? We have healthy bodies to carry the pregnancy or to support the person who's pregnant, to support the birth of the baby, but to support we need lots of health to create a healthy family, right? Okay. So let's move on to the next topic of how do we eat to support healthy preconception, and what does the science say is the best way to eat? So I'm going to just jump right into talk about what the kind of not consensus is, but the two ways of eating that have the most science supporting them for increasing fertility. And the first is the Mediterranean diet. And of course, the Mediterranean diet is the most studied diet. So for a lot of conditions, it shows that it's helpful and that there's this big body of research behind it, but that's because it's the most studied diet, right? But for fertility, we see that it looks like individuals who do eat a Mediterranean diet have 44% lower risk of infertility than those who eat a Western diet. So that's pretty strong. But whenever we see that the Mediterranean diet is cited, we always have to question, would whole food plant-based eating be even better? But we just don't know because it hasn't been studied in this capacity. I do think it is a good question to ask. And I do think that it would be great to have more studies in this area with whole food plant-based eating, because we know, for example, when we're talking about blood pressure, and there's the DASH diet. I'm going on a little tangent here. There's a DASH diet, which is essentially the same as the Mediterranean diet. There's a few differing factors, specifically much lower sodium in the DASH diet to control hypertension. It's interesting that the studies on the DASH diet actually conclude, if you go way, way back in the literature, you see that the studies show that it's truly a whole food plant-based diet that is the most effective at reversing, normalizing high blood pressure, but that they created the DASH diet because they thought it would be more palatable for, us Western citizens or whatever. And so, this is why now whenever I see Mediterranean or DASH diet as being a very, very healthful diet for anything, I have to ask myself, would whole food plant-based eating be even better? But we just don't know. To be figured out, right? The other study that has, or the other diet that has a lot of science behind it, or, kind of more comprehensive science behind it, is called the fertility diet. And this was a diet that came to be from a study, the Nurses' Health Study, where they looked at almost 18,000 women who had no history of infertility, and they controlled for all the other lifestyle factors, smoking, BMI, alcohol, everything like that. And they asked the question, okay, what are these healthy, fertile women eating? What they found was that these women were eating a higher consumption of monounsaturated fats and less saturated fat, less trans fat. They were getting more of their protein from plant sources and less from animal sources. They were eating more of their carbohydrates were like on the low glycemic index. So in other words, they weren't eating as many processed carbs. They were eating more whole grains. And then also they were eating high fat dairy. We're going to be talking about dairy. I'm just going through the list here though. They also were getting plenty of iron either from plant foods or supplements. And they were also taking multivitamin supplements. So we'll talk about those last 3 points in more depth. But we see that between these two ways of eating, Mediterranean and fertility diet, they overlap a lot. More plants, less animal protein. The Mediterranean diet still includes some eggs and fish and dairy. Looks like the fertility diet still included dairy and fish. So there's a lot of overlap, less saturated fat, more unsaturated fat, more polyunsaturated omega-3 fatty acids. So, when you look at kind of the nutritional science around fertility, the science is really clear that trans fats are not helpful for fertility. Processed meats are not helpful. Processed sugar is not helpful. And the science is really clear that more unsaturated fats versus saturated fats are helpful. More whole grains are helpful versus processed grains. And more fruits and vegetables. More fruits and vegetables. So, when we look at these trends, the question is still, so then would whole food plant-based eating be even greater? But let's talk about the foods that are up for debate still. Dairy being one of them, because the science really isn't strong here. There's not a big consensus on dairy, whether it's helpful for fertility or not, even though it is included in Mediterranean and the fertility diet. There's some conflicting evidence. Some of the science, for example, shows that increased dairy intake is associated with a higher risk of infertility. Some studies show that it has zero impact on infertility or fertility. And some studies show that high-fat dairy might actually increase healthy birth rates in IVF patients, but not the case with low-fat dairy. We also see that like I said, the fertility diet showed that high-fat dairy consumption, was normally consumed by those fertile women in that study. But then, there's another interesting research through Harvard that concluded that higher dairy protein intake was associated with lower follicle counts in the ovaries. So essentially increased ovarian aging. So we see, there's research in both directions here. And that's why there's no solid kind of recommendation around dairy. Of course, my argument is that there's so many factors in dairy. Is it just the hormones and the growth factors that are contained in this dairy that might have an impact on fertility? Is it also the fact that dairy is often contaminated with pesticides, herbicides, all these environmental toxicities that can also have an impact on fertility? So I think that, there's definitely room for some more clear science to take place. But from what we know just about dairy, about also what, this high amount of saturated fat, hormones, growth hormone, those reproductive hormones, how it can interfere with our own delicate hormonal balance. Also, how the unclean dairy can have that environmental toxicity impact on our bodies. From my perspective, I chose not to have dairy, and I choose not to eat dairy. But just wanted to kind of, put it out there, the science unbiased for you to kind of consume yourself. Okay, now what about fish? Is fish good for fertility, good for the preconception phase? And it is included in the fertility diet. It's also included in the Mediterranean diet, the two diets that have been shown to be helpful for fertility. However, once again, it's important to recognize that there haven't been any studies specifically looking at the impact of the bioaccumulated toxicity in these fish on fertility rates. So that needs to be looked into for sure. I will say one benefit of consuming fish is that you get a good dietary source of EPA and DHA, our anti-inflammatory omega-3 fatty acids that are so important for the neurodevelopment of the fetus. However, we know that we don't have to eat fish in order to get good sources of EPA and DHA. So it's not necessary. And I guess, the conclusion that I draw from, these two food groups that are still up for debate is that it's clear that they're not needed. They're not necessary for a healthy pregnancy, because we'll be talking about this in next week's episode, that when we look at the overall data on, the rates of, healthy births, healthy delivery from vegan moms versus omnivorous moms, we see that there's, not a detriment of being a vegan mom, that having a vegan pregnancy is very much healthy, but like all pregnancies, requires a little bit of nutritional planning and considerations. So anyway, moving on from these kind of debated food groups, dairy, fish, whether they're good for fertility, good for the preconception phase, we need to talk more about overall the specific nutrients that are so important for healthy conception. But before we do that, I forgot one more food group that is highly kind of, sometimes debated. We need to talk about soy, because soy actually has a ton of research around it related to fertility, because soy, of course, contains phytoestrogens. And so soy, kind of like dairy, has some conflicting evidence around it, but actually the majority of the science around soy points towards the direction of it being supportive for fertility, or at least having no effect on fertility, but not hurting fertility, or not detracting from a couple's attempts to get pregnant. So let's just look quickly at the research behind soy. We see that for females, soy either helps or has no impact. So for example, in one study, soy intake in women undergoing infertility treatment, the women who had more soy intake had 77% higher rates of live births than those who didn't consume soy products. So that's a really big difference, right? In another study, soy helped with embryo implantation. In a third study, soy increased endometrial thickness, which can contribute to higher pregnancy rates. In another study, it was simply shown that increased phytoestrogen concentration was higher in women who became pregnant compared with those women who didn't become pregnant, and that the higher concentrations of phytoestrogens were also associated with a shorter time to get pregnant. So these are all studies in support of soy. There was one study that was a little inconclusive that showed that higher rates of soy phytoestrogens, or isoflavones, were actually correlated with a 13% rate of more likely to never get pregnant. So there's a 13% chance of, 13% more likely to not get pregnant. However, this study didn't really kind of control for, or didn't factor in whether these women were trying to get pregnant or not. It was just kind of a more kind of global study looking at, blood isoflavone concentrations and whether a woman had ever gotten pregnant or not. So inconclusive study there. And for men, let's look at the research for men. This is where it gets more conflicting because there was a study showing that higher intake of soy foods led to or correlated with lower sperm count. However, the sperm in this study, in the men who did have the highest intake of soy foods, their sperm motility, their sperm morphology, and their ejaculate volume were similar regardless of soy intake. So the health of those sperm was not impacted, but there was a lower sperm count. However, then there's another study that shows there was zero impact on infertility, either positive or negative from soy intake. So it's quite inconclusive. But when we look at the meta-analysis of 38 clinical studies, we conclude here that there are no effects of soy or isoflavones, from soy on testosterone or estrogen levels that have been found. So, from all of this long tangent, it seems as though soy is certainly not harmful and could very much be positive for the preconception phase. Okay, now that we've talked about just kind of dietary patterns and fertility, I'll just kind of wrap up that section by saying, in my opinion, whole food plant-based eating is such a positive, supportive way of eating for the preconception phase because not only do we prevent so many of these kind of metabolic related issues that can also impact fertility, right? Insulin resistance, obesity, and other kind of metabolically related conditions that can creep up during the pregnancy phase, like high blood pressure and high blood glucose. Whole food plant-based eating really helps to prevent or reverse these metabolic conditions, right? Also, whole food plant-based eating is so abundant in the vitamins and minerals that we need to carry out a healthy pregnancy. Of course, we're going to be talking so much more about this today and next week. That, in my opinion, great way to eat, right? But we don't have the science that says so yet, really. Okay, but let's talk about the specific nutrients that are key for healthy preconception phase. And if we are whole food plant-based and wanting to conceive, do we have to go out of our way to make sure we are getting these specific nutrients? So the following nutrients have been shown to be super, super important for fertility. Vitamin B12, and we'll talk a little bit more about each one of these, omega-3 fatty acids, folic acid, and then iodine, very important. And then vitamin D, debatable. We're also going to talk about iron and calcium because they're so important for the pregnant mother. Okay, so first talking about vitamin B12, it's been shown that women with healthy levels of B12 are more likely to get pregnant. It's also been shown that for women who have deficient levels of B12, they have a higher risk of their baby having neural tube defects. So B12 is a really important vitamin. We definitely want to make sure that we are supplementing with B12 if we are eating a whole food plant-based diet. And the recommended dose for that is typically 250 micrograms a day. We're going to do a little supplement roundup at the end of this discussion. So moving on to omega-3 fatty acids, as we've mentioned before, it's been shown that women who have regular intake of omega-3s are more likely to get pregnant. Also, and this is likely due to the fact that DHA and ALA intake improve embryo morphology. And also there's interesting science showing that intake of these essential fatty acids reduces risk for preterm delivery, risk of low birth weight. And so it's so important also for the neurodevelopment of the baby. And so with the preconception phase, we can get a good source of ALA from flax and chia. But the question is, do vegan mothers wanting to conceive, do they need to have a direct source of DHA, EPA? During pregnancy, it's been shown to be very, very supportive and is recommended by the American Academy of Pediatrics to get a direct source of DHA. And so you could extend that. You could extend that into the preconception phase as well and consider supplementing with an algae supplement. So something definitely to consider. I actually personally was not supplementing with algae in my preconception phase. I was just relying on flax and chia to get a good source of ALA and trusting my body was converting that into the EPA and DHA that I needed. However, this is a less reliable way to know if you're getting that good amount of EPA, DHA, because you don't know at what rate your body is converting the ALA into DHA and EPA. The only way to really know what your omega-3 status is to test your omega-3 index. So that's always an option as well. And I forgot to say, when you're trying to conceive, it's always a great idea to get your practitioner on board to get any necessary testing covered and also to talk about this nutrition, to talk about all these factors that play into fertility. Okay, moving on to the next nutrient that's very important for fertility, folic acid. It's also been shown that women who supplement with folic acid, higher or equal to 400 micrograms a day, are more likely to get pregnant. And remember, this is the nutrient that's so important in that 3rd and 4th week after conception for preventing neural tube defects. So this is the main reason why there's a big recommendation out there to start prenatals when you're trying to conceive, so that you make sure you've got good folic acid levels or folate levels. And of course, folate is abundant in the plant-based diet, whole food plant-based diet, if you're eating a lot of whole grains and a lot of leafy greens. So it's not really something to be concerned about. However, there is a small chance still that if we bring up the discussion of methylation and folate and individuals who might have an MTHFR variant, essentially a gene that doesn't allow for them to methylate folate and convert inactive folate into active folate, then this can increase the risk of neural tube defects as well. So in this case, we'd want to make sure that the form of folate is in methylfolate, which is the active form of folate. Okay, vitamin D. The science is debatable about whether vitamin D really impacts fertility rates. Some studies definitely suggest that women who have sufficient vitamin D levels have higher fertility. Other studies say it has no impact, but we know that vitamin D is so important for so many other things, right? So we always want to make sure we've got good, adequate vitamin D levels. The best way to know is to test regularly once a year. And we'd want to supplement if we have lower levels. Also, we'd probably, if we live, you know what we say about vitamin D, but if you live in a cloudy environment, if you live somewhere where you're not going outside for like 3 months or 4 months of the year, probably a maintenance dose of vitamin D is a good idea, right? Okay, and then iodine is another nutrient that's very, very important for proper development of the fetus, especially also early on as well. Iodine can be attained in the whole food plant-based diet through seaweed. That was where I was getting my iodine from. Once you get pregnant, you might want to switch over to a more reliable form and dosage of iodine to make sure you're definitely getting that ideal range for iodine, not too much, not too little. And we'll be talking about that in next week's episode when we talk about pregnancy. But the other 2 minerals that are important also to take into consideration during this preconception phase are iron and calcium, both of which are abundant in a whole food plant-based lifestyle. If you're eating your great leafy greens and cruciferous vegetables and beans, for example. But these are important to make sure that they are replete in the mother's body, because iron is one of the minerals that we go through really quickly when we're pregnant because we have to produce so much extra blood. So iron levels typically can go down when we're pregnant. And iron deficiency is definitely, a risk for the growth of the baby. And that's why iron is a mineral, or, hemoglobin is tested for throughout pregnancy for the mom. But we want to set ourselves up for success in the prenatal or the preconception phase by making sure that we've got good iron levels, good hemoglobin levels. Also calcium. Calcium is just One of those minerals we want to make sure that we're getting an abundance of in our diet from eating enough of these great plant foods, because we share so much of our calcium with our baby for the growth of their bones. In pregnancy, on a daily basis, we give 50 to 300 milligrams of calcium over to our baby for that bone development. So we need to make sure our levels are good to maintain our bone health, because we will sacrifice our bone health for the bone health of the fetus during pregnancy. So when we kind of, take a step back and look at this as a whole, we do see that whole food plant-based eating is wonderful, provides an abundance of minerals and vitamins for this preconception phase. However, it can definitely be however, we definitely do need to supplement with vitamin B12. Vitamin B12 is necessary with whole food plant-based eating when we're trying to conceive. And vitamin D is another really important one, just to make sure that we keep our levels good and healthy. And then other supplements to consider in the preconception phase would be omega-3 fatty acids, folic acid, or folate, if you just want to have a good insurance policy to make sure that your levels are great for those first few weeks of pregnancy, where that neural tube development is so important. Then that could be something to consider as well. And then iodine, making sure that you're either getting a good source through your seaweeds, or, some individuals, and many people recommend this, you may want to consider actually just starting that prenatal, because that really is going to cover a lot of nutritional bases as well. We're going to be talking so much more about that question of, to take a prenatal or not in next week's episode. As you can see, I'm already leaning towards, it can be nice also to just have the peace of mind of getting some of these nutrients covered with a prenatal. But I know there are some diehard whole food plant-based eaters out there, some purists that may be, considering how can I support a healthy pregnancy with just nutrition from food. I'm going to be sharing my story, my journey with that in next week's episode, as well as a little bit of a teaser. All right, so the supplement summary, I'm just going to knock it out real fast with the amounts as well. Vitamin B12, 250 micrograms a day. Vitamin D, check blood levels and supplement accordingly, or maintenance dose would be 1,000 IU a day. Folate, research shows 400 micrograms a day. Iodine, 125 micrograms is the recommended daily allowance, or required daily allowance for non-pregnant women. And then omega-3 fatty acids, the amount that's really been shown to be helpful is no less than 200 milligrams a day of DHA from algae oil. This is all good information to talk with your practitioner about. Of course, you always want to talk to your practitioner before you make any nutritional decisions. And this is a very important time in life where, we just want to make sure that we are covering our nutritional bases before we carry out a pregnancy. So I was going to talk about some other lifestyle factors that go into preconception. I don't really have time. I'm running out. We're already 33 minutes into this episode here. Maybe I'll just mention them because they are important to consider, even though I wanted to focus on nutrition for these podcasts. But some other lifestyle factors just to always take into consideration: smoking. And what's included in here is smoking marijuana. Marijuana actually really strongly impacts fertility rates, decreases it immensely for women. It can affect their menstrual cycles. It can reduce the number of eggs obtained for IVF, people who are doing IVF. And for men, I just want to mention that THC interferes with the production of testosterone and causes a direct decrease in sperm production, sperm motility, and also decreased sexual desire. So, just need to really mention that as a big factor. Also, alcohol negatively affects fertility. Either a low or high BMI will negatively affect fertility. Anything that disrupts the circadian rhythm, so shift working, chronic stress, majorly can impact fertility. Excessive caffeine, over 200 milligrams a day. And then many herbs and medications are also contraindicated when you're trying to conceive. So you always want to check in with your practitioner to make sure, especially if you're trying to conceive, that none of those herbs or medications could cause any harm to the developing fetus. And environmental toxicity is such a big topic that, yes, we have many podcast episodes on environmental toxicity and liver health and all of that stuff. But just know that the cleaner your body, the less toxic your body, the more harmonious of an environment is going to be for a developing baby. So anyway, that was a long episode with a lot of information. I hope some of it was valuable for you. And next week, I'm so excited to talk about nutrition for a plant-based pregnancy. Yay! All right, everyone. Okay, I'll see you next week for that episode. Hope you have a great week ahead, and see you next time. Bye for now.